In this video, I'm going to talk about depression, cause of depression, and also type of depressions. And I'm going to talk about a little bit about treatments. Of course, there are different type of treatments for different type of depressions, but I cannot just explain all in details here. And you should just please keep in mind, this is only general information. It's not a treatment for every cases, and it's not diagnosis. If you think that you have some symptoms, and you need to just consult with your family doctors, physicians, or see a psychologist, psychotherapists, and you need to do it one-on-one. These are all general information. It's just for education. We all feel sad and unmotivated sometimes, but depression is more than feeling low. Depression is a serious condition that alters our mood and changes our thoughts, feelings, and our behaviors. And depression is classified as a mood disorder. And what is the cause of depression? Depression can be caused only by one factor alone or a combination of many factors, including biological, psychological, and environmental. So depression can be a result of only dysfunctions of the brain's chemical structures, and or a result of a certain life events or situation. Depression can be broken into categories on the severity of symptoms. Some people experience mild and temporary of the depressive episodes, whilst others experience severe and ongoing depressive episodes in their life. I'm going to just introduce you different types of depressions very briefly, just to get an idea about different types. The most severe one is called major depression disorder. It's also known as a clinical depression, and it is the most severe form of depression. The second one is called dysthymia. It is also known as a persistent depressive disorder. It is very chronic depression, and it stays a couple of years. It might stays for years, if especially people, they don't want to get a treatment for that. The third one is called manic depression. It is also known as a bipolar. It causes extreme mood swings. Number 4, postpartum depression. It is very common that women after giving birth, due to dramatic hormonal changes, experience sadness, and this state cause baby blues, and it takes several weeks, but 1 in 7 women experience something more than that. The very severe conditions that is called postpartum depression, and it stays longer, maybe for a few months, and mothers experience and struggles with sadness, anxiety, angers. Number 5 is called seasonal affective disorder, or the abbreviation is SAD. This depression is related to the changes of the seasons, and it usually starts in the beginning of the fall. People who live in a colder countries, especially with less light during the day, they experience more than people who live in warmer countries, and they have a mild winter and fall. And number 6 is called situational depression, which is also known as a adjustment disorder. It is related to the it is short term usually, and it is related to the traumatic event in life, or any situation that has happened. For example, loss of your beloved one, getting divorced, or losing your job. This could be related to that, and it's short term. At the end, I just wanted to mention once again, feeling down at times is part of normal life, and sad and upsetting events happens to everybody. But if you're feeling down and hopeless on a regular basis, you might need to see your family physicians, to a specialist or a therapist, and to speak and consult with them, because you might deal with depression. And again, it depends on what kind of depressions you're going through, how severe it is. The treatment would be different, but the best treatment based on studies that they have done it and all the research that they found out, the best treatment for depression is combination of medication and psychotherapy. Once again, if you feel that you're depressed, please contact a specialist. The first step is consult with your family physician, and they can refer you to psychologists or psychotherapists or whatever is best for you.